I'm from Sioux Falls here. Was here for 18 years of my life until I graduated from high school at Sioux Falls Christian. And then medical school was at the University of South Dakota Sanford School of Medicine, so I came back to the area after my undergrad training. I love to be challenged. I love the sciences. I love to help people. And I think that it marries, being a doctor marries all those things together. I also love to lead a team. And being a physician is a fantastic way to lead a team in order to help patients where they're at and help with their fundamental needs. So that's why I want to become a physician. I actually didn't know much about pain medicine coming into my anesthesiology training, but that is a subspecialty of anesthesiology, so you do rotations in pain medicine. And as I started doing those rotations, I enjoyed being with patients in the clinic. I found myself really wanting to help them in their chronic pain conditions, and it married both that desire to help patients who are in chronic pain with the interventional side of things that we do in anesthesiology that I love so much. And so I love the specialty because a lot of these patients have debilitating pain that takes away from some of the goals that they have in their lives. And I know how many goals I have and the things that I want to accomplish, and being in pain would be a very much detriment to that. So I want to work with patients, give them the tools in order to get back to the goals that they want to get to. So what we can do is we can do things like we can give injections of steroids to decrease any inflammation that can be causing pain, but we can also do ablation of nerves to try to decrease the amount of transmitting of pain that those nerves are doing. And then there's also even more interventional, more operating room based procedures that we can do, like spinal cord stimulation, or we can change the way in which we're giving medications through intrathecal pumps. So I have a family, I have kids, I love to spend time with them. I like to go on trips with them as much as I can. I also like to be, like I said, stimulated intellectually, both with my job here at Avera and as a physician, but I also love to be intellectually stimulated I read a little bit of philosophy. I like to do that, and I like to be involved with my church as well. So that dominates a lot of my time outside of work.